Welcome to Inclusion Matters, a podcast about children's development from the Center for Inclusive Childcare.
Welcome to Inclusion Matters. I'm your host, Cindy Croft, and I'm here with my co-host, Priscilla Weigel. Hi, Priscilla.
Hi, Cindy.
So we have been thinking about expanding the conversation that we had in two previous podcasts on the Americans with Disabilities Act. And we were thinking, for those listening to us, that this would be maybe a time to talk to parents about the rights of their child or children to be included in community settings as prescribed under the Americans with Disabilities Act. And so that's what we want to talk about a little bit today, maybe give parents some tips, but also our early childhood providers who are listening. It's still a good information for you, I think, as you try to make sure you're building those connections and getting all the information you need to feel successful.
True. Very true. It'll be helpful, I think, for all.
So we know that sometimes we talk to parents who are struggling to find childcare, and maybe you could talk a little bit about some of your experiences, Priscilla.
Yeah, we get a lot of calls from parents who are kind of at the end of the list, a long list. I talked to a parent yesterday that had called 15 sites and actually had not even visited any of those 15 sites, but just over the phone had talked to the providers and shared information about her child and was told, nope, I don't think this is going to be a fit. We don't provide care for kids with special needs. We don't support children who are on IEPs. A lot of things that we know, according to the Americans with Disabilities Act, that they really aren't allowed to say, having especially never met the child.
Right, exactly. And we know that maybe some child care providers are not as aware of the child's civil rights as we would hope they would be, and we're trying to do as much as we can to educate. But when providers get that call from parents, sometimes in the experiences that we've had in talking to parents, we know that parents can just do kind of an information dump about their child that isn't necessarily positive. And so maybe you could tell us a little bit about, the approach for parents that are listening of pre-enrollment when they make that first call looking for a site.
I think that often we're talking the other day, it's parents really truly want to start out on the best foot. And so they feel sharing as much information as possible is the way to go, when really what they should be doing is gathering information for themselves first by asking some questions. And we really are encouraging families to build a relationship with this provider, because this provider is going to be caring for their most precious thing in the world, their child. So questions like, tell me about some of the strengths that your staff have. What are some of the areas of expertise that you know teachers in your setting provide in their classroom space, in their childcare setting? What type of training do you provide your staff? How are your staff trained? What are their credentials? Where do they receive their training? How do you access up-to-date, new research, evidence-based trainings throughout your state and your area? One other thing that I think is often forgotten to ask is, will you tell me about your guidance policies? What do you do when a child is having a tough day? How do you handle that? How does your staff handle that? What are your safety policies? What are your policies for illness and all of those? So just adding it to those questions that you would typically add, but remember to ask about guidance, because that is foundational to the success of every child, truly.
And then we want to also talk to parents about how then they present, because then the provider is going to say, well, tell me about your child. And what parents, I think, need to be more aware of is talking to that provider about their child's strengths. So don't launch right into the concerns that you've had in the past with other programs. But talk about, what does your child like to do? Where does your child like to play? How does he make friends? What's his communication style? Provide that kind of information. And then as you're having the conversation with the child care program, you can say, in addition, my child has an IEP, and this is the particular concern or area of need my child has. Here's what works really well at home. and I want to be a partner to you as the child care program to make sure that you're successful and my child's successful in this setting. So what else do you need to know from me? But that kind of approach is much less, I think, startling or for a provider. If you start with my child's been refused care in 6 other programs, or my child has already been in 4 programs and he was expelled from every one, and I'm just desperate to talk to you, that sets a tone that's different on the receiving end for the provider.
Right. And I think building that relationship, helping each other get to know that child in the most positive light. All children have strengths, and all children have bumps on the road too. So providing that information right off the bat, and when you do talk about the IEP, saying, I know as a parent that I have a right to expect that the IEP team would really be willing to share and talk with you, and that's okay with you. So I'm going to make sure that all that paperwork gets processed and signed so that you can have an opportunity to learn more about what my child's doing in the special ed services, because all of that is going to be helpful to really provide a well-rounded day.
And for parents who are listening as well, there are resources that you can bring to the table with the child care program. And again, approaching this in a positive, strength-based way is much more effective in building that initial relationship and having that conversation. So you can say things, for instance, in Minnesota, there is a free program for coaching for child care programs specific to kids with disabilities or infants and toddlers or health and safety kinds of practices. So you can come in with that information. That's a tool right away the provider can use. In addition, on our website, inclusivechildcare.org, we have lots of tip sheets that are specific to some kinds of special needs, and certainly more generally to inclusion and inclusion strategies. You can certainly make a referral to that if they don't know about the CICC yet.
Right.
So those are a couple of resources. The relationship or the professional relationships that you have with perhaps specialists working with your child, that can sometimes be a strength as well to offer to providers.
Right.
So think about those kinds of things. If there's some hesitation or the provider doesn't seem sure about whether inclusion would be the step they want to take, even though, as we know, discrimination is not allowed under the law.
Right.
But we're also not trying to be too hard on people. We want it to work for families.
Right.
We want it to work for children. We want it to work for the educator.
Right. And this child has never been in that setting. And so we don't know if it's not going to be a successful match. And how will we know until we try? So our services are available, all of the other supports that you've just mentioned, and that parent who's a partner in the success of their child. They want what's best. And we know child care providers do too. So we're all in this together to create really optimal child development opportunities for all children.
Yes, excellent. And for people who are listening, if you have a question, regardless of whether you're in Minnesota or outside of our state, we have a Ask an Expert feature on our website, and we also have a Ask, and it's info@inclusivechildcare.org. Those are easy ways that you could bring a question to some of our specialists here, and we will gather as much information as we can about the questions that you may have. So just another resource for providers or parents who are struggling.
Yep, that's great.
Great. Well, thank you, Priscilla.
Thanks, Cindy.
Thanks for listening. For more resources, visit us at inclusivechildcare.org.